In our bodies, tiny nerve cells send signals by passing electrical ions to each other. We take in oxygen by breathing and nutrients by eating. Our blood carries these things around our bodies. Iron, for example, joins with protein to make hemoglobin, which carries oxygen. Oxygen is super important for our bodies to work. If you eat too many carbs, your body uses up the nutrients needed to break them down. This means it steals nutrients that are needed to break down protein. So even if you eat a lot of protein, the carbs get broken down first and the protein goes to waste. This is why people who eat lots of carbs sometimes have smelly gas and poop. The extra carbs get stored as fat and you end up not having enough of the nutrients you need. People who have bulimia or anorexia often have another problem called functional hyperglycemia. This happens because when you eat carbs, your body makes insulin. Insulin helps store sugar in your blood as fat. Eating too many carbs makes your body release too much insulin, which can make your blood sugar drop too low. If your body has problems making insulin, you can get diabetes, which makes your blood sugar stay too high. Our bodies are designed to break down protein. The energy we get from breaking down carbs is only a tiny bit compared to the energy we get from breaking down protein. When we don't have enough energy, our brains tell our bodies to do things. They say, get more nutrients. Heart, work harder to carry nutrients. Rest so you don't use energy. Breathe in more oxygen. This makes our brains and bodies go a little haywire. Our brains release noradrenaline and our bodies release adrenaline. This can make your heart race, your chest hurt, make you sleepy, give you a headache, or make you yawn a lot. Both bulimia and anorexia start with eating too many carbs. Some people go back and forth between the two. With anorexia, the noradrenaline makes you feel anxious and scared of gaining weight, so you don't eat. With bulimia, you throw up, so you don't gain weight. Anorexia can be more dangerous to your body, but if you understand how it works and eat enough protein and vitamins, you can get better faster. Bulimia can be hard to recover from because it can cause an addiction by increasing dopamine D1 receptors. These receptors are like saying, give me a reward now. Dopamine D2 receptors are like saying, I'll work for a reward. They give you motivation. D1 receptors are like when your brain learns that if you do a trick, you get a treat. This can become an addiction if you only reward yourself. Winning at gambling gives you dopamine. A kind person makes you feel good and gives you dopamine. Seeing your favorite celebrity smile makes you happy and gives you dopamine. Alcohol addiction, bulimia, all these things can happen because of too many D1 receptors. Serotonin controls D2 receptors, and something called 5-HT receptors are involved in how serotonin works. If you don't have enough serotonin, your D2 receptors don't work well, and you lose your motivation. This is what depression is. Your body makes serotonin from tryptophan, but it uses tryptophan to make niacin first, which helps carry serotonin in your brain. So if you don't have enough niacin, you can't make serotonin from tryptophan, and you can get depressed. Taking niacin supplements won't help if you don't have enough protein. To get better, you need lots of protein, vitamins C and E, B vitamins, niacin and iron. You also need to eat fewer carbs. If you have an addiction, you need to be patient and learn to get rewards from stimulating your D2 receptors instead. Changing your body to use protein better and stopping your body from taking in too many carbs can also help.